More and more children and youth with special health care needs are transitioning out of pediatric care into adult care than ever before because of all the advances in our ability to care for children with special needs. That creates a unique problem in that we're not completely ready for transition necessarily. So that means that a time of transition can be a time of vulnerability, a time that's a little bit frightening for the family, for the youth, for the pediatrician, for the adult care provider. Unfortunately, that should be a time for celebration. That should be a time when we look back at the accomplishments that we've been able to achieve during childhood, the goals that we've reached, and look forward with enthusiasm to the next 10 years of our life. To make that time of transition a time for celebration and excitement, it's important that we prepare for it. And preparing for transition begins early in childhood and early in adolescence especially. What happens is the child starts to assume more and more of the responsibility for their care. How do appointments get made? What medications am I on? What condition do I have? How do I explain my special need to a physician? And so the transition process is a process during which the child assumes more and more responsibility for their care, and the parent relinquishes more and more of their responsibility. And both of those roles are difficult. It's not easy for a child to pick up that knowledge, and it's not always easy for a parent to give up some of that responsibility for their child's care. But that's an important part of transition. Transitioning isn't easy for the pediatrician either. It's looking forward to the loss of a relationship that's been established over 15, 18, 19 years. And it's a strong relationship, and part of the relationship has always been working together to overcome obstacles and working together to achieve goals. So it's a little bit of a barrier when the family and the youth and the pediatrician have to look forward to that time when their partnership dissolves and the youth and the family go on to a new partnership with an adult provider. And that reluctance is in part because I think the family, the pediatrician and the youth aren't ready or don't feel comfortable addressing that time when they part company. But to make transition work, starting early on in adolescence to get ready for transition is very important.